of Nigeria, which part of the world are you logged in from? It's saying waiting for Ask Dr Rita show. Why?
Supposed to be live.
Hmm?
Supposed to be live. Not live.
So I feel I need to see myself. I need to see what's happening. So I welcome you into this live session. I'd like to know where you are logged in from. So please tell me, where are you watching from? Please drop in the comment section. Where are you watching from? Today we are talking about the men and the women matter. And it's a series that is going to run through all through the month of September into October, because the men and women matter series it's a lot of topics in it. We're going to get into fertility, we're going to get into different issues, and I want to take time to explain what it is, what you stand to, what you need to know, and how you need to, what choices you need to make to have a better life, especially as regards your men and your women matter. So we're live on YouTube, we're live on Facebook, we're live on Instagram, and I'm welcoming all of you to this session. Please kindly drop a comment and let us know where you are logged in from. Just take a few minutes to just allow some more people to log in. Okay, so I'm waving on the Instagram. I'm waving at Evans. Evans, I have waved at you. You're welcome to this show. Please, in the comment section, kindly let me know where you are logged in from. Okay, Lagos, Ondo State, thank you. Thank you very much for logging in. Please drop in the comment section where you are logged in from. Thank you. Thank you. Welcome to the Men and Women Matter session today. We're going to start in earnest, but I'd like to know where you are logged in from. And I tell you, today you are going to learn a lot, because we are dealing with issues that concern men and women. And I'm going to start with the men. Why did I start this topic? Why did I decide? So my male clients have been accusing me that every video I do have to do with women. I've done video on PID, I've done a lot of videos on women related issues, and there's nothing that has been done about the men. And I decided that, okay, this month of September, October into November, we're going to just go like that from topic to topic, and as well as provide you with solutions of things you need to do. And so I welcome you, Jerusha. I'm sure thank you, good evening. I'm sure you're from, please tell me where you're coming, participating from. Thank you, Abuja, thank you. All right, Abiola from Abeokuta, thank you for logging in. Thank you so much. Thank you. I welcome you from wherever you're watching us from. Yes, thank you, Sandra from Lagos. Thank you for logging in. All right, so let's get to the meat of the day. As much as possible, I'm going to try to keep this session within 1 hour. So wherever we're able to stop, we're going to continue in 2 weeks' time. You know, the program is every 2 weeks, so that I can have some time to build together the topic. So today, we're starting with the men and women series, as I said, and we are going to be looking at, in this first phase of, welcome Mr. Emmanuel, thank you for logging in. We're going to be looking at erectile dysfunction. We're going to be looking at penile atrophy or penile shrinkage. We're also going to be looking at low libido in men, low libido in women. We're also going to be looking under the low libido in women. We're going to be looking also at painful sex in women. I hope we're able to take this. This is supposed to be like the first for this week, and the next week we move into something else. But as much as I can, I would want to take all the topics I have, my slides, and then as well as take questions that will come up in the course of my speaking with you. So, what is erectile dysfunction? Erectile dysfunction is a disease of the male reproductive system, the male reproductive organ. And the main symptom of this erectile dysfunction is that the male is unable to achieve or maintain an erection for sex. Now, there are several factors that can cause this, but let me just quickly just give a little overview of the erectile dysfunction. So that's male erection, sorry. So the male erection, really, for a man to get to have an erection, is as a result of both the physical and mental coordination. So the physical aspect and then the mental coordination. And in this part, the emotions also play a huge part in it and work together to give erection, to give a complete erection. So, however, an erectile dysfunction can be as a result of several diseases or several health complaints that people do not usually associate to be a contributing factor to erectile dysfunction. Oftentimes, people just assume that erectile dysfunction just happened, and especially when I interact with my patient, a lot of my male patients, not all of them, but several of them, every man wants to make sure that their sexual performance is improved. And so it's a topic that even as a woman, you need to know so that you can help your husband or your partner, so that you can know how to help them. So it's very important that you take very key attention to this information and these things that you are learning today. So what are the causes of erectile dysfunction? Number one cause that people do not know is usually as a result of kidney malfunction. The kidneys, one of the functions of the kidney, and this now, when I'm talking erectile dysfunction, remember that erectile is not the same as not being interested in sex. This one is that the person is interested in sex. It's just that the person, even though he's interested in sex, is unable to achieve an erection, is unable to sustain an erection, is unable to maintain an erection. So there's a difference between someone who is not interested, what you would call as a low libido, lack of interest in sex, and someone who has an interest in sex and is not able to perform. So the first aspect we are dealing with today is someone who has interest in sex but is unable to perform, whether it is a man or it is a woman. You want to have, you feel like you should have sex, but you find out that you are not able to enjoy sex, or you find that you are having challenges with sex, then this session is for you. I'd like to know where you are joining in from. Please drop your location, and I just want to be sure that, so to acknowledge you in this program. Thank you. All right, so this is, yes, Mr. Ayo, thank you from Warri, thank you for logging in, thank you so much for logging in. So what are the causes of erectile dysfunction? I said that number one is kidney malfunction. I remember I was having a conversation with a client, and I was telling him that one of the ways to know that your kidney functions are reducing is your ability to maintain erection. And he was like, what now concerns kidney? I said yes, because part of the function of the kidney is also to help in the functioning of the reproductive organ. And anything that is going wrong will first manifest in symptoms like erectile dysfunction. So sometimes this inability to maintain an erection could mean that there's a problem is coming up with the kidney. So you need to not just look for something to drink to just give you a quick boost, but no, you need to ensure that, okay, all right, I welcome you, Bolinti. Yeah, thank you for joining into the program. Thank you. Yes, thank you for joining in. Thank you, David from Lagos. Thank you. Hey, I'm clapping for you. Thank you so much for joining us today. So you need to find out. Yeah, good evening, Ejimudo Precious. Thank you for logging in from Ghana. Wow, thank you for logging in. That's beautiful. Thank you for logging in. Thank you so much. I truly appreciate it. All right, so I said one of the causes is kidney malfunction can be a cause of erectile dysfunction. The second cause of erectile dysfunction could be heart-related conditions. And I want you to understand that for you to be able to maintain an erection, blood must be able to flow to your penis, to your organ, you know. And if the male genitalia actually requires blood supply, there needs to be a lot of sufficient blood supply in the penis. And so if the heart is having a problem, then it will ensure that vital organs required for functioning, you know, get supply before pleasure. So the body is going to prioritize what supply first, you know. And so when you want to get an erection and the liver needs to have blood flow, the body is going to weigh that and ensure that first of all the liver has enough supply to do the work that it needs to do. And so you may find out that you are interested in sex but you are not able to maintain an erection. So sometimes you want to check your heart functioning. Hormonal imbalance can also be a cause of erectile dysfunction, because for a man has testosterone, and testosterone is this hormone that is responsible for erection, and this hormone that is responsible for erection, and you know, usually as a man ages, it observes that there is a reduction in the amount of testosterone that the person has. I hope you can still hear me. I hope you are still there. Thank you very much. Please let me know, where are you logged in from? Increased. If it's as a result of hormonal imbalances, you want to ensure that are we still live? All right, thank you very much. You can hear me loud and clear. Thank you so much. All right, I hope you are learning something beautiful. Thank you so much. Okay, so I said, so another cause of erectile dysfunction is obesity. Obesity is a condition where your weight is more than your body's required limit. Now, there's something you call your body mass index. There's a range that helps you. Usually you measure your height, your weight, you know, and by the time you do that calculation, it will tell you. And so obesity, you don't use, of course you can use your eyes to know that this person is big, but you know, sometimes someone may not be looking very big, or you may not consider someone as being obese, but for their body mass index they are already obese. That is to say that the amount of fat deposits stored around organs inside the body is too much. Now sometimes when this is happening, you know, the person begins to have protruded abdomen, the stomach, around the stomach, the waist region, fat begins to deposit more. That's one of the ways that you can use to check yourself, you know. So you want to ensure that your weight is within normal range. Your weight is within normal range, and so obesity can be a cause. So if you are having erectile dysfunction as a result of obesity, it doesn't matter how much drugs you are drinking, it doesn't matter what supplements you are taking, it doesn't matter what herbs you are taking, you may not be able to, it may not be something your body can sustain. It will mean that you will keep having to take those things. If you don't take it, you will not be all right. If you don't take it, you will not be all right. So if the erectile dysfunction, so you want to find out, am I having kidney related problem? Am I having heart related problem? Is my hormonal levels beginning to be affected? Usually it's when you are above like 60, 65. Of course, I know that hormones differ for each person, because I mean there are other factors that can affect hormonal levels. But you know, age, you know, sometimes when the man has reached andropause, where it's a condition known as andropause, where as a result of age there's a decline in the testosterone in the body, so that may reduce it, you know. But it's not, you don't be quick to say, oh, it's age. There are other factors that may be contributing to it that is beyond age. So but if you just conclude and say, oh, it's age, you may not give yourself the opportunity to find out what is appropriate for you, you know. So other factors that can cause reduction in, that's erectile dysfunction. That means to say that inability to maintain erection, inability to sustain erection, you know, either before sex, during sex, you know, you are not just able to get an erection. Even when you wake up in the morning, sometimes, most times I ask men, when you wake up in the morning, do you wake up with an erection? That is another classic sign for you to know whether it's not just that when you want to have sex. When you wake up in the morning, the amount of blood that gets to your penis is an indication of your health, your general health, or your male health, you know. So you want to find out, when I wake up, do I have erection? Is it flaccid? Is it, you know? So you want to check yourself. Now these things are very important, you know. Thank you so much. Oh, in those, yes, from Akwa Ibom. Thank you for logging in to the program. I welcome you. Thank you. All right, so you want to find out if, you know, you are maintaining erection. So another factor now, so I'm going into number 5. I think number 5, high levels of cholesterol. A lot of times people have undermined the impact that cholesterol will have on their reproductive health, whether as a male or as a female. Your cholesterol levels, when they continually get abnormally high, they cause a condition known as arteriosclerosis. That was why I took time to take us on cholesterol. I took time to take us on liver fat. Please refer to those videos, they are there, you know. And then what you can do to keep your cholesterol within, please go to those videos. Now when you have very high cholesterol, what has happened is that the amount of blood that can pass through your arteries are reduced. Now this reduction in blood that passes through will reduce the amount of blood that gets to any part of your body, especially from your waist down. And so that may reduce the amount of blood that gets to your inner region. So you need to ensure that your cholesterols are within normal range. So when you are, as a man, you are observing that your erection is beginning to be affected, then check all these things. Ensure that these things, are you hypertensive? You know, you need to ensure that your blood pressure is kept within control. Of course, I know that there are blood pressure medications, and some of these medications have a tendency to reduce sexual function, you know. But their lifestyle, as we go through my slides, you will find things that you can do to make your health to be better, you know. So I just want to say to you that you should stay with me, and let's get you information that can help you to be well. So diabetes is another thing that can cause erectile dysfunction. Now I spent some time to talk to you about the diabetes. I talked a lot about it in the last video. Please, it's there, you can watch it. If it's your first time, please kindly log in and watch it, you know. So diabetes, what makes diabetes to be a problem? One of the ways that diabetes becomes a problem is because over time there is damage to the nerves and to the muscles, you know, the nerves and the muscles around the male genitalia, you know. So these damages affect the ability for you to get an erection. Also, remember I told you, I said sugar can be toxic. The toxicity of sugar in the blood, excess of sugar that is not controlled, you know, that can be a cause. Also, we have insomnia. Insomnia is a condition where you are not able to sleep, you're not able to sleep well, you know. These things can affect you as a man, as a woman. Insomnia, in fact, there are 2 studies that I came across in the course of preparation for this slide. One, the correlation between the size of your abdomen and your ability to maintain erection. In fact, they say that if your stomach is bigger than, you know, is protruded the more protruded your stomach, the lesser your ability to have an erection or sustain an erection. As a woman, the bigger your stomach, the less the tendency for you to have interest in sex, to even, you know, I was surprised. I was really surprised when I came across that study this afternoon as I was checking into one of my researchers, and you know, I was linked to that study, and I was like, wow, there are several things that relate to that. We'll get into it, but insomnia can affect you. So if you're not sleeping well, you have trained yourself not to sleep well, you say, oh, they told you that if you sleep for 8 hours, if you calculate by some years, you would have slept some 1/3 of your life. You are just preparing yourself gradually, because it is in sleep that your body repairs itself. So the more you deprive yourself, the more several of all these other functions begin to reduce. So if you are a man, you are watching me, or a woman, you are watching me, and you observe that your husband does not have enough rest, it's time for you to draw their attention to this video, that look, you need to make out time to sleep. 4 hours is not enough, 3 hours is not enough, 5 hours is not. You need to get at least 6 hours of good quality sleep if you are interested in ensuring that your erection is well. Now don't say, oh, my erection is still okay. You are still 42 years old. I'm telling you things that if you start doing it now, when you are 70, you still have very good erection. Don't be quick to say, oh, age does not mean that as you grow older, there is reduction in hormonal levels. Yes, it doesn't mean that there is absence of hormone, and there are certain things that you can do that keeps your hormonal levels, you know, that keeps them vibrantly within range, you know, so they don't just go into isolation, or they don't just pack up and say, oh, we have finished our work. After all, you are not menstruating. You know, you were never menstruating, so why should you now have absence of hormone? You know, there are lifestyles that affect our hormonal balance. You know, so we're going to get into that. Side effect of other drugs, drugs that people are on, and those drugs, the effect of those drugs, I tell you, they have massive effect on the body. They have massive effect on the ability for you to sustain an erection or get an erection. Inactive or sedentary lifestyle. That is another major cause of erectile dysfunction. Now, if I've mentioned diseases can be a part of it. I mentioned kidney disease, I mentioned liver disease, heart diseases, you know, I mentioned hormonal imbalance, but now I'm now mentioning other things that people do. I mentioned high cholesterol, which can be as a result of lifestyle and all that. But then inactive or sedentary lifestyle, you sit down as a man, you enter the office and you sit down from morning till night, you don't get up, you don't do anything. You just observe from yourself that after a while, you just begin to observe that you are not able to perform when you want to perform. You are not able to get erection, or you are not even able to sustain your erection. Long driving, people who do long hours driving, they are driving. In fact, most drivers, there are statistics that showed people that do haulage in UK. It was a study that was done in the UK about people who are into long distance driving. Those long distance driving that people do, it showed that very many of those people came down with problems with their reproductive system. One key point of it was erectile dysfunction, and so that's why I don't know when that law was made, but I think that when you drive for 8 hours, you park and have some time to rest, and then you continue again. You know, so shifts. Although there are some people that want to make money to be complete, especially Nigerians who relocate out of the country, they want to ensure that they gather all the money, and so even when they tell them to go on break or are supposed to have break, they want to cover those hours. These things have long-term effects on your body. Prostate problem can be a cause of erectile dysfunction. Now, what are the solutions that you can do? What are the things that you can do? One thing that you can do is to identify the cause. What is the cause of this erectile dysfunction? Why are you having erectile dysfunction? We identify, of all these things I've mentioned, you need to identify which one is the one that concerns you. You know, which one relates to you. Do you smoke? How much of alcohol do you take? You know, all these things have effects. They have long-term effects, even if you don't see it right now. So somebody says, I'm an occasional drinker, I'm an occasional smoker, occasional smoker, I say, okay, how often do you smoke? He say, I smoke every day, two stick of cigarette. I say, how long have you been doing that? He said 15 years. I say, you have done a lot of, that's cumulatively, that's a lot. You see? So people will say, oh, I'm having this complaint, but I don't know why. Sometimes you know why, but you just don't want to be real to yourself as to why you're having the complaints you're having. So I'm encouraging you this evening, as a woman, as a man, why you need to, don't just be quick to say, I want to look for something to drink. No, don't be quick to look for something to drink. No. First of all, find out, why am I having erectile dysfunction? Is that as a result of hormones? There are certain things that you can eat that usually are very good. You just add them to your cereals, things like flaxseed, they are very good. Now this is not going to help if your hormonal levels, if you think your hormones are imbalanced, you can add flaxseed, you can add chia seed. Some of these seeds, they have some plant based, because they are plant, they have certain nutrients in them that help to improve hormonal activities in the body. So it will be good for you to add them to your diet. Whether you are having erectile dysfunction or not, it's good to add them to your diet. Dehydration is another cause of sexual erectile dysfunction. Drink water once in a while. You drink instead of drinking water, you decide to drink mineral first. When you are not well hydrated, it will definitely affect you. It will definitely affect your sexual function. So dehydration, you can imagine someone who is dehydrated, dehydration is the cause of his erectile dysfunction, and is beginning to drink medication. What is it doing? It's going to be putting a lot of pressure on the body. It's going to put a lot of pressure on the organs. So it's very important that you take note and find out what is that will help improve your sexual function. Drink water every 3 hours. That's something that really usually works. Drinking water every 3 hours will improve your it will always improve your sexual function. As a man, as a woman, it will improve it. Every 3 hours drink water. So what do I mean? 6 a.m. and I don't mean drink 1 gallon. It could just be like 100 or 150 ml of water. 100 ml, 150 ml of water. Take it by 6 a.m. You don't need to add anything. You just drink ordinary water. By 9 you drink again. By 12 you drink. By 3 you drink. By 6 you drink. And then because of sleeping in the night, I often tell people, don't drink so much water into the night, so that you are not you're not going to be waking up to sleep, waking up to go and have time to go and sleep. Then you need to get active. As a man, remember I told you that the size of your stomach, there is a correlation between the size of your stomach and your erectile function. So if your stomach is getting big, certainly your erectile functions will begin to be affected. So get active. Do exercise to reduce your abdominal gait. I remember that some years ago, I think like 3 years ago, in 2020, I put together a compilation of exercises for seniors. If you want that exercise for seniors, it's usually for people above 60 years of age, but anybody can do those exercises. So those exercises, anybody can do those exercises. So I want you to please ensure that you drop a comment in this comment section, and then your details. You can drop your number or just make a request and to be sent to you, to your email. You can drop your email to be sent to you. And then, so as a man, there's something that I want you to know, that there's a fruit that is very good. Now, this is not a Viagra. This is something that is good, that will help you. And this is what? Watermelon. You need to eat plenty of water. It's not as if you just go and buy one slice of watermelon and eat it and say no. You need to eat a lot of it, up to 250 grams. I don't know how to measure 250 grams, but I think at least 1/4 of a watermelon should be giving you 250 grams. You need to eat that every day. And you eat the watermelon, you eat the seeds with it. That is a very good boost that can boost your erectile function. So I would encourage you, get plenty of watermelon. Eat watermelon. Eat a lot of watermelon. Watermelon is good for the man. You can never go wrong with watermelon. Whether you're diabetic, whether you're hypertensive, whatever condition you have, watermelon is more water-based. So So I move to the second topic now. Second topic. So I'm watching. I'd like to know where you logged in from. Let me know where you are logged in from at this time. You can drop it in the comment section. I'd like to know where you are logged in from, if you can hear me. All right, the next topic. This topic, in fact, like I told you, these topics are based on my consultations with my patients, you know, and accusations that came up as a result of consultations that you are not doing anything for the women, everything for the men, everything is woman, this, woman that, you know. So I decided to go live and start the live with men today. So I've talked about erectile dysfunction. The second thing that I'm going to be talking to you about is penile atrophy or penile shrinkage. Now, penile shrinkage is a condition where the penis of a man reduces in size, in circumference, you know, whatever it is that makes it to reduce in size. Now, there are several things that can cause it. So if you're a man, I need you to pay very keen attention to these things I'm talking to you about this evening. You know, so why is the music not playing? Sorry, I told them I wanted music to play at the background. I don't know why they're not playing the music. Okay, so penile atrophy or shrinkage. And I said that this is a condition where the penis reduces in size or length. Now, this is often as a result of age. Medications can cause it. Lifestyle habits such as smoking, such as weight gain. Usually, it doesn't usually require treatment. So I'm going to be telling you the things that you can do to prevent your penis as a man from shrinking. Very, very important. So I already talked about the causes. I said, number one, aging can be as a cause. And why does this happen? As men age, fatty deposits build up in the arteries, and this causes reduced blood flow to the penis. Now, this reduction in blood flow, it reduces the muscle cells which are in the erectile tubes inside the penis, and these become weaker. Now, these tubes inside of the penis are supposed to enlarge, they're supposed to produce erection when they are engorged with blood. So when there is less blood flow, it means that there will be smaller or fewer firm erections. And if you remember when I talked to you, when I was talking about erectile dysfunction, I talked to you about that people can have high cholesterol can be a contributing factor. So if you have always been having, say, my only problem has been high cholesterol, that high cholesterol must be dealt with. My only problem has been fatty liver, that fatty liver must be dealt with. If you need to have meaningful sexual experience, it has to be dealt with. So aside from fat deposits that now goes to reduce the, you know, fat now, like I said, when you are adding weight, you are not only adding weight where you can see. Inside of your penis, you can have some fat deposit that will go and block arteries. And so amount of blood that is getting there, amount of blood that is getting to your muscles around the penis is reduced. When this continues for so long, you become flaccid. When the flaccidity continues for so long, what happens? You begin to shrink. So I have quite a number of consultations that come around penile shrinkage. You see, this is gradually becoming a 20, 23, 24, 25, 26, 27, 28. I'm calling years now. You know, if Christ tarries, problems, these are future problems for men that are coming. And the issue is that the man does not know where he will go and say it, because his ego is greatly affected by these things. You see? So as a man, you are here listening to me. Please pay very keen attention. The last thing you want is to make your penis to shrink and become shorter and shorter and shorter and shorter and shorter. So, and one of the things that can cause it, when we say aging, it's not that because you are now older, that is the reason. The fact is not because you are older. No, the fact is that the fatty deposits that build up in your arteries, that they also build up the arteries to apply the penis. These deposits, they also, when they build up in the arteries, they build up in the tissues. You see? And when these build up, they reduce, they cause a contraction. So this is very, very important. Another possible cause for penile shrinkage is buildup of scar tissues, and these come from years of injuries. So during sexual intercourse, you need to ensure that you are careful. I usually tell my patients when I'm having a close-up consultation with them, and I tell them, I say, look, when you are having sex, ensure that your partner is well shaved. Hair is something that can cause injury. You yourself shave your pelvic region properly, and then ensure that your partners shave properly. You see, it's because some of these injuries can cause, small injuries, they can cause scars. An accumulation of scar tissues, the tissue around the penis is what you call they are spongy tissues, and so they can easily become injured. You see, they are easily injured. So you need to ensure that you avoid having injuries, whether microscopic or macroscopic injuries. You need to be careful. Another thing that can cause it, I mentioned it, is weight gain. Weight gain around your stomach is a concern, and then when you're adding weight, what is happening is that the penis will begin to look as if it's smaller. It's not as if it has shrunk per se. The reason is that the penis is attached to the abdominal wall, and when the belly expands, what happens? It will pull up, it will pull it in. So as you lose weight, those ones that are pulled in, they will come out again. So it is important that you get active. You must take your exercise seriously. If your sexual health is important to you as a man, you must ensure that you take care of yourself, and in taking care of yourself, you ensure that you make sure that you do exercises. You can do walking, you can do swimming. Swimming is a very good exercise. If you can swim, that's a good advantage for you as a man. You see, it's good. Thank you so much, Mr. Abdul Wahid from Ibadan. Thank you so much. Thank you for logging into the session today. So I told you, I said weight gain. We're talking now, we've talked about erectile dysfunction. The next thing we're talking about is penile atrophy or penile shrinkage. And I'm telling you the things that can cause a man's penis to shrink. And I said the first thing would be as a result of increased cholesterol, increased fatty tissues, as that comes with aging, not because of age per se, but because of increased level of cholesterol in the body. And I talked about increased weight gain, particularly around the abdominal region. I said when the abdominal region, when your weight is much, what happens? Because the penis is attached to the abdominal cavity, it would cause it to shrink inward, and so when you lose weight, it will descend again. So all you need to do is to ensure that you do exercises. Very important. Prostate surgery, this is another reason. Now while someone may need to do a prostatectomy because of several factors, there are factors that can cause that, but it's usually has been seen that maybe in the course of the surgery, although now there are more modern technologies where that allows for the surgery to be even robotic, to be for infrared, so the chances of this shrinkage from this surgery may not be now as common as it used to be, but it also often happens, and it depends on the technique that is used. So that procedure can affect your penis and make it to shrink. There's a disease that men have that I have had quite a number of people who have had it, and it's called the Peyronie's disease. And in this disease, it happens that when there is an injury for whatever reason, it causes fibrous scar tissues to develop inside of the penis then it now makes the penis to curve abnormal. So this is a condition where there is an abnormal curvature of the penis. There will not be pain at the initial stage, but eventually it may cause pain. You see, it may not be pain at the initial stage, but eventually it may cause pain. You don't find out that there is a curve. When the man is getting an erection, it becomes curved. The curvature, the fibrous tissue, the more fibrous tissue form, the more curved it is. And then, I mean, I've had someone send me a picture someday, and I just told the person, I said there has to be a reconstruction, because when there's a structural disruption, then there may need to be a surgery. A surgery is usually done so that some of those fibrous tissue, they can be removed, and then it can be done in such a way that it can be straightened as best as it can. But this Peyronie's disease can cause a reduction in the length, reduction in circumference of a man's penis, and sometimes it could go on its own because the body is able to resolve the scar tissue. At other times, it may require that the man has surgery, because it may cause pain during sexual intercourse. In fact, during sexual intercourse, a man that has this condition is the man that will be feeling the pain. He will not, when he has anything makes him to have an erection, it is crazy pain that he'll be having. Crazy pain. When I mean crazy pain. You know, so there are medications that can cause penile shrinkage, and there are different kind of medications, antidepressants, even medication for that is usually taken for prostate. When there's a constriction, it can also cause it. I don't want to call different medications because I don't want anybody to be saying, what of this one? Oh, I'm using this one. No, so I'm just going to give you generic this thing. So, you know, there are several medications that can cause penis to shrink, and usually these things are written on the label. Please read the label for the side effects of the drugs that you are taking to ensure that it is not, you're not being affected. Smoking. Chemicals from cigarettes. They say smokers are liable to die young. Smokers are liable to have penile atrophy. You know why? The chemicals in the cigarette, they injure the blood vessels, and not just they injure all the blood vessels, but particularly also they affect the vessels in the penis, and this will reduce the penis from filling with blood and stretching. So even when the man is stimulated, because he has been smoking, he used to be a smoker. Now, you know, there are different types of smokers. You have second-hand smoker and first-hand smoker. A second-hand smoker is someone who doesn't smoke, but is ingesting the cigarette, ingesting the fumes from the cigarette. So you need to ensure that you are not a second-hand smoker. Why should you inherit a problem that should ordinarily not come to you because you want to hang out with people, or you want to stay in a room? If you go into a room and you find that this is a smoking room, don't go and stay in a room that a smoker has stayed. You will just be using your lungs to purify the air in that place. Please don't do that. Now, smoking can cause your penis to shrink. And when I mean smoking, I mean anything you smoke. Smoke shisha, you smoke weed, you smoke anything you smoke, not just cigarettes, they can damage the penis. So what are the ways? How do you reverse? What are the ways to reverse shrinkage, to prevent shrinkage? Number one, stay in shape. Very important. You have to stay in shape. If you want to improve your sexual life, you need to be fit. You must be fit. You cannot want to have a very good sexual life and you are not physically fit. So you must decide that you are going to be physically fit. You must maintain a healthy diet. A healthy diet is not the one that you eat only protein, you are not eating carbohydrates. No, a healthy diet is a combination of all the classes of food. In your food, there should be protein, there should be carbohydrate, there should be vegetables, there should be fruit, you know, there should be oil, there should be everything it should be a balanced diet. A healthy meal should have these things. You know, so it's important that you take note of these things and use them. You understand? Use them to improve on yourself and improve yourself. Ways to reverse shrinkage. You stay in shape, maintain a healthy diet, you know, take steps to improve your overall health. You hear this advice every day, but you probably didn't hear that if you are not taking care of your health, it can cause your penis to shrink. And you know that, I don't know whether there is penile donation, whether anybody donates for anybody, but that one that you have, please take care of it very well. Now, another thing that can cause it to shrink is disuse. There's a law of life, a law of the body, which is that any body part that you do not use, you will lose. if that's why you find out that when people are immobile for as a result of injury or something, their limbs begins to reduce. Why? Because the muscle mass is built from activity and action. The same thing with your penis. If you don't use it, it will shrink. So like any other part of your body, it requires for you to use it. You need to exercise it, you need to use it regularly. And what does that mean? You should have sex. So I was talking to a couple. I was in a consultation within the week, and I was talking to a couple, and I asked the woman, I said, so tell me, when was the last time? She said, what we are both, that's both the man and the woman, they are quite elderly. And the woman was like, well, I beg, Dr. Rita, what are we using it to do now? I said, your husband needs it. Oh. Your husband was looking at me because he probably was not expecting me to say that. I said, your husband you need to have sex. I said, even you as a woman who is already in menopause, you need to have sex. She said, I said, yes. I said, if you don't have sex, you will have disuse. Disuse happens to both male and female. So your female reproductive organs, your genitalia, you need to use it. Your using it is what makes more, makes the cells there, they produce more, So if you are not using it, if you sit down and say, well, the woman, exactly what she said, well, Dr. Rita, what are we have given birth? I said, it's not for giving birth. Your purpose is not for giving birth. I welcome you on Instagram. I welcome you for joining the live show. Thank you for logging in. Thank you. I like to know where you're logged in from. Please let us know where you're logged in from, and also on YouTube. So I'm talking to you about how to improve your sexual life as a male, and I'm talking, and the Men Matter series, and I've talked already about erectile dysfunction, and then I'm talking to you about penile shrinkage, and I'm telling you the things that can cause it. I've told you the things that can cause it, and I'm telling you ways to prevent your penis from shrinking. And I said at first, you need to stay healthy, you need to be active, you need to be physical. Then now I'm now telling you that you need to use it, you need to use your organ. If you don't use it, you will lose it. And I said, even for a man, even for a woman, if you are not having sex, your vagina, when we get to the women's side, I want to avoid bringing women matter. When I'm discussing men, let me finish so that I can land well. And when I get into men, I can, But you cannot say you are not having sex. You have sex once in a month. Really? Disuse is going to come in, especially if you are married. If you are not married, stay in one place until you get married, So, but disuse will come to you, if you are married, and you are, especially if you are, your husband and yourself, you are already getting above 45 into 50s. Please ensure that you do not stay so long without having sex. You must have regular sex. Why? Because these activities, they create blood flow for the woman, for the man. When you're having sex, there's blood flow to that area, and so it is beneficial for your health. It is helpful that you understand that the penis is designed to be erect and filled with blood from time to time. So, and one of the ways for it to be erect and be filled with blood is during sexual intercourse. You see, so if you stay and you're having sex once in a month, once in 2 weeks, in fact, somebody asked me what is a good time. I say a good minimum good time is like let me not speak like that. In a very good health, we're talking how to be well, how to remain well. There are lots of benefits. In the next class, I'm going to be talking to you about the benefit of sex, having sex, the benefit it has to you as an individual. You see, sex is not just for you to procreate. Thank you, Becky Sugar, for logging into this program. We're talking about how to improve your sexual life. We're also talking about erectile dysfunction in men. We're talking about penile shrinkage in women. In men, not women. So what are the things that can cause a man's penis to shrink? What are the things that can cause a man's penis to atrophy? That means for the muscles to just become flaccid and nothing is making it. So, and I said that you need to have sex. As the man, you need to have sex. As the woman, you need to have sex. Both of you must have sex. And I said the lowest time you should have sex in a week is 2 times. Two times is the lowest time. So if a man goes on for too long without having an erection, what happens? The collagen, which are the smooth muscles, elastin and other erectile tissues, will begin to deteriorate. And as a result of this, it will result in loss of penile length, the growth and the limitation to one's ability to having an erection. So sometimes a man that is complaining that I'm not having, and I ask her, so when last you have sex, say, I'm said now, do you not see what is happening in this country now? What is happening in this country? How does that now make me? How does that do? That is why you need to have sex, to calm yourself down. Sex is one of the ways to relieve stress. So whether you are in menopause, whether you are in andropause, whether you are a young person, you are in your married, please ensure that you plan it, put it in your daily plan, put it in your weekly plan with your husband, plan it, and then find a way to to have a good sexual life. It is important so that both you, the woman, your female area will not atrophy, you man, your male genital area will not also atrophy. Atrophy can happen to both man and to woman. When we get to women's side, we will discuss it, but right now I'm talking about the men. And so you can also, one of the ways to prevent shrinkage is by exercising your penis. Exercise your penis by being sexually active. I already talked about that, and I said maintain a healthy lifestyle, avoid smoking, and then do pelvic muscles, pelvic muscle exercise. They're what you call Kegels. For a woman, you can do a Kegel exercise. You hold the muscles around your pelvic region. Hold it, like as if you want to wee. Hold it tight, and count to 30. Then release. Then do it again. Then release. That is an exercise that you do for the pelvic region. When you do this exercise, what happens? That is one of the ways you exercise that region. There are other exercises that you can do. You can do aerobics, you can do flexibility exercise, all these, and there are several kind of exercises you can do. You can also check those up online, or you can drop a comment if you want more details about the exercise. Another way now to prevent shrinkage, remember we talked about the perineal disease, where there is injury that can cause fibrous tissue that can cause the penis to curve abnormally. Now be careful when you're having sex. I said as a man, tell your partner shave. Ensure these are things that reduce injury for the woman, injury for the man. Both of you should ensure that your pelvic areas are always clean and shaved up properly. When new hair is coming up, trim it so that they don't have unnecessary injury. And then also when you're having sex, be careful with the sexual styles that you do. There are people that have landed themselves into trouble. Penile injuries are emergency. They are emergency that require emergency, and so one of the things you want to do is to make sure that you avoid unnecessary injury in your penile area. Please ensure that you do that. So ensure that you don't have fracture, ensure that you don't have cuts, ensure that you don't have injuries. Any form of injury, you understand, around your penis or in your penis is very, very important. So next thing that you can do is as soon as you have a prostate surgery. Now when people have prostate surgery, this one thing that I've observed is that they just have prostate surgery and then the man just sits down and say, I've had prostate surgery, and then he's not now having sex. Or the wife is like, he just finished having. As soon as you finish surgery, as you reach out like this and you are able to, please try as much as possible to resume sex. You may not be able to do every day, but at least try once a week after surgery. Try. Why? You cause blood flow to that area, and then you quickly rehabilitation. The way somebody who has had an injury in the leg and they remove the plaster, they now begin to teach the person how to walk. The same thing, you rehabilitate your penis after a surgery in your pelvic region to prevent disuse. You see, very, very important. So there are very many rehabilitation strategies that can help you get back. But one of the key things, like I said, is a Kegels exercise. That exercise is very, very good. And so in conclusion, I want to say that as a man, as men, as you age, your sexual function may diminish, it diminishes. Yes, but we can fight these changes. When people say that, as a result of age, no. As you age, yes, you are getting younger. Yes, functions are reducing. Yes, but you can. There are things that you can do to keep yourself at your optimal level. Remember that optimal level. I did a presentation, I did a webinar on optimal health, and I told you that optimal level is being at your best level of performance at every point. So your best level at 30 years may not be your same best level at 40 years, but it should not be less than. You see, but you must ensure that you are operating in optimal health, and there are things that you can do. One of the key things are things I've mentioned to you, which I've said to you, that you must maintain a healthy lifestyle. A healthy lifestyle, you must quit smoking, you must reduce if your sexual health is important to you, you have to measure your alcohol consumption. alcohol consumption will affect you. See, if your sexual health is very important to you, you cannot just be drinking as you like, and then when you finish drinking as you like, then you now say you must, if your penile size, penile health, penile functionability is important to you, please ensure that you manage your alcohol consumption. You make sure that your abdomen, your stomach, the size of your stomach, ensure that it is not. If you stand still, you should be able to see your toes. There should not be any gallop. The more gallop you are seeing, the less your sexual performance, and then the higher the chances of shrinkage. So I believe that I've been able to answer all the men that sent me all these questions, and in the next series we would get into some other topics of the men, like low sperm count. How do you improve? What are the things that people do that is contributing to low sperm count, and then what are the things that then we now look at male infertility. So we'll look at that in the subsequent series. But right now I want to quickly go into I said I didn't want to exceed 1 hour 1 hour 30 minutes in all for both the slides and the question and answer session. So I'm already on top of the hour now, so I want to quickly get into the low libido in women. Now, low libido in women. Low libido is an absence of the desire for sex. Generally, when somebody has low libido, that means whether it is a man or a woman, the person does not have desire. It's not that the person cannot get an erection. The person just does not have interest in sex. So that's a different condition from someone who has, interest and cannot get an erection, even though they want to get an erection. Sometimes it's also called impotence or sexual erectile dysfunction. The man is interested in having sex. The man wants to have sex, but is unable to maintain an erection. Is unable to get an erection. Is unable to maintain an erection during sex or before sex. So it becomes frustrating for the man. In a woman, the woman in the case I'm dealing with now is that the woman is not interested in the absence of there is the absence of the desire for sex. Now, when I ask a lot of women during consultation, they tell me, I'm not interested. I don't feel like I don't have sexual urges. I have low sexual urge. So all these things are all low libido in women. So they find it difficult to being aroused. They tell me that my husband will do. I'm not just being aroused. They are unable. They say I don't achieve an orgasm. I'm not going to take orgasm today. That is another topic on its own. That when you want to take that topic, it is a topic on its own. What is orgasm? How do you because a lot of times people have overrated orgasm, or let me not say overrated it. They have made it to look like as if there's something, but I'm sure with understanding you will be able to have a better sexual experience. So I welcome you from Instagram. I welcome you for joining into this program. Thank you for joining in. Thank you so much from wherever you're logging in. Thank you for joining us. I'm live on all the platforms. So on Instagram they said I'm giving them side view. So let me adjust my camera well so that it's not just side view. I'm giving them my yes. Thank you so much. I believe this is much better now. Thank you. All right. So low libido in women, and I said that is inability to have desire, inability to be aroused, inability to get to orgasm, inability to enjoy sex, inability to low libido. Now, this is not a physical problem most of the times, although there can be a physical reason for it, but most of the time it is a sexual disability. So that a woman does not have desire for sex doesn't mean that the woman is having a problem with her. Like she's not having a problem. She's not having a problem, So she shouldn't be looking at herself as if there's something wrong with me, because most of the time the women come from the point of something is wrong with me. It's not a physical problem. It's a sexual disability. You see? So you need to first understand that. So there's a difference between someone having sexual disability, inability to have desire for sex. It's a sexual disability. Now, you just don't feel like doing it. Whether there are reasons for it, we'll go into several reasons. And this could be a state of mind. it could be the state of mind, it can be impaired by also metabolic problems that have there. So there are other physical symptoms that can contribute it. Not that the person, something is now wrong with the person, no, but there are some things that can trigger it. It could be from the mental or emotional point of view, or it could be from functionality of organs. So I want you to understand that sometimes this inability, lack of desire, it could just be that there's something that your body is trying to get your attention to, that you need to pay attention to. So it's very important that you pay attention to these things and you take advantage of these things that you are learning today. Thank you so much for the love that you are sharing. Thank you for the love. Thank you so much. Yeah, I like to know where you are logged in from. I like to believe that you are learning so much from me. I like to know that what you are learning is something that is useful to you. So please drop it in the comment section. Let me know that you are getting some valuable information at this time. I'm watching, I'm looking out for it. Okay, so there are several factors, and they could be liver function. It could be a reduction in your liver function. A reduction in your liver function as a woman can affect your desire for sex. So if you have an imbalance in your liver function, it can affect you. You see, if you have, when I was talking about the men, I talked to them about that one of the key functions of the kidneys is to help the reproductive organs. If there is a disturbance with the kidney function, it can affect. So when you observe that you are not having interest, even when different things are being done, you are fine, go and do some laboratory check. A liver function test, a kidney function test. These two tests can always show you something. Thank you, Doris Balogun from Ibadan. Wow, good to have Ibadan people here. Yeah, that's good. I think I'm going to begin to do a statistics to know where the highest participants are coming from. I like to know where they are coming from. And so sometimes too, hormonal imbalance can also cause a woman to have low desire, absence of desire in sex. Now let's look at the mind. What are the mind factors that can affect a woman or make her not have desire? One key thing is sexual abuse. A woman who has been abused sexually, whether as a young lady or whatever it is, may become averse to having sex. Now that adversity would affect their ability to want to enjoy sex, affect their ability to want to be aroused, because they have been violated in the past. So if you have been sexually abused, it is very, don't say that, you see, don't say that you have prayed it away. It's good, I know that prayer can help, but you see, there's an injury that needs to be healed. You need to speak to a therapist. You need to go and do therapy. It is very important. If you have been in a relationship where you were physically abused, you need, as a woman, I'm talking to you today, you need to go and get, to see a therapist. You need to heal from inside. If you are, I'm telling you, because we tend to want to, sweep these things under the rug. The things you sweep under the rug, they just form a bump on your carpet when you're walking. They don't disappear. They are there. Depending on what it is you sweep, after a while they may begin to smell, they may decay, but they form a bump. They don't ever go away. So if there's a sexual abuse, a sexual harassment, a sexual molestation, you need to deal with it. Otherwise, you may not enjoy sex. And I've had people who is in the course of consultation with me, I ask them, does your husband know that you were molested? Be like, no. I'm like, why does she not know that? Does he not know you're molested? Say, I don't want to tell you, I don't want to feel bad. I don't say that it is already affecting your sexual life, whether you know or you don't, whether you agree or you don't agree, because you see, your subconscious activities, your subconscious action will tell during sex. Your ability to relax and enjoy sex will show. Your ability to be aroused will show when your partner is trying to get your attention sexually. So if there is an abuse, you need to deal with it. You need to deal with it, and in dealing with it, you may need to, look at the whole circumstance around it, and then thank you so much. Yeah, thank you. You need to deal with it, and when you have dealt with it, there are different stages of healing after such an injury. That's another class entirely, but just so I don't digress from the things I want to talk about. But if there's an abuse, you need to talk about it. Who was it that abused you? You need to talk about it to someone that you trust. That's why I said go and see a psychologist, go for therapy. You have been abused, you have been in an abusive relationship. Go before you move into another relationship. Please ensure that you go through this process. It's important. And then this is one of the things that health assessment helps us to help me to do with my patient, because during health assessment we explore both your physical, your spirit, your psychological, your mental, your sexual. We go through different phases of your life. What are we trying to do? We're trying to bring out some things, and then it's usually sometimes this assessment goes on for up to 3 hours. I'm telling you why. Because we're trying to get the person from where they are on the track that can get them to healing and to help them to remain well. So you need to find a way to get to a therapist who will help you. Very, very important. You need to go and do a therapist. I went through divorce. I was divorced. I've been divorced now for some years now. And after a point, I had to go and do therapy. I needed to, so that I would not be looking at everybody suspicious, looking at every man suspicious. No. So I'm telling you that there's a place for these things. You need to ensure that you are in a state of mental health, emotional health, if you're going to enjoy sex. If you don't have mental health, emotional health, there's nothing I say that will work. It may not work. It may not work. Thank you, Daddy. Another thing again that you need to work on that can affect your sexual health, is insomnia. You not sleeping. If you're not sleeping well, you will not be able to enjoy sex. You will not have interest in sex. In fact, you will be irritated, you will be agitated, you will not be able to. So you have to ensure that you are sleeping well. If you know that you have a baby or you have something that affects you from sleeping in the night, then make up during the day. But whatever the case is, you must sleep. Lack of opportunity to emotional conflict. Emotional conflicts can be a reason why someone is not able to get interest or able to have a desire or able to be aroused. Why? Because there is conflict. It has to be resolved. That's why I said whatever emotional conflict you have to do a resolution. If you have an issue with your husband, don't bottle it up. There has to be communication. Communication problem will affect you. You need to be able to talk about the things that you like. You must talk about the things you are not enjoying. You must talk about it. You must talk to your partner. You have to talk to your partner. You need to talk to your partner. Another thing that makes women not to have desire in sex is low self-esteem. They don't like themselves. They don't like their body. They don't appreciate their body. They wish they are someone else. They wish they were somewhere else. They wish they were married to someone else. They wish they do not. So low self-esteem can affect your desire for sex. And some of all these things you can address during a psychotherapy. It will help you, because remember that we are addressing the mind aspect. Your poor personal perception. You look at yourself and say, look at how I am. You see, you must enjoy yourself. When people come and tell me, I want to lose weight, I ask them, why do you want to lose weight? Your reason for wanting to lose weight, why do you want to lose weight? You must know why do you want to lose weight. It has to be other than so that people will like you. They will still not like you. I'm telling you, they will still not like you. There was a time I was very thin. If you see me then, they used to call me I, very, very thin. Then I became as big as size 18. Then I started hearing, you're too big, you're too big, you're too big. And then it dawned on me. Then I've been on both sides of the scale, and I'm like, just be yourself. You see? And so when you want to lose weight, why do you want to lose weight? You can be big and be beautiful and appreciate yourself. But because of the health risk of being obese, the risk on your heart, on your liver, on your kidney and other organs, it's always good to be fit. It's always good that your size is not more than the proportion of fat in your body is not more than the body can handle, so that you do not submerge the fat surrounds all of the organs are surrounded with fat. You don't want a situation where by this casing is now choking up the organs. That in itself is a problem. I I've seen a lot of cases of fatty liver in the last 3 months. The number of fatty liver that I've attended to has been alarmingly high. And why? Because of high levels of cholesterol over the years that have not been resolved. So you see, those are the implications of but you know, you must appreciate yourself, you must value yourself, you must love yourself, you must know that you are the only one of yourself that exists, and you must love yourself. You must be able to look at the mirror and say, yes, I'm beautiful. You know, so low self-esteem, poor personal perception may not make you to, you know, make you to have interest in sex. Poor worldview, when you suspect everybody, you are suspecting your spouse, you are suspecting your partner, you are suspecting everybody as being, you know, this may not make you to have interest, because for you to be able to have interest, you must get to a point of relaxation and then allow the other person to come into you. So for that to happen, and it has to happen naturally, and your mind cannot be, you know, exempted from that. You understand? So if you are experiencing any of all these things, then you can book a session with me, and then we can deal with it. We can find a way out for you and then help you. Metabolic reasons. Now, metabolic reasons are reasons aside from your mind, you see, that can cause. And we know that low blood levels. Now, I don't know if I mentioned it during the male erectile dysfunction. Please, if your blood volume is low, you will have erectile dysfunction. If you are short of blood, you will have erectile dysfunction. So you must, it's one of the reasons that when you are doing tests, you do your liver function test, you do your kidney function test, you do your lipid profile, you do your full blood count and your blood analysis. You see, if you are battling with low blood, there are some people that have very low blood. That is the condition that they have. They battle with it. There are some people that have too much blood. You see, that is another problem. Too low, too much, you have problem. You have problem. All your cells of your body will be paining you. So your blood levels matter. You see, so for you as a woman, you want to have interest in sex. If you are battling with anemic, you may not have interest in sex, because at that point your body is thinking of how to get more red blood cells. It's not thinking of how to have pleasure. Remember, I told you, I said for pleasure to happen, the organs in the body must not be in the time of risk. The body is not considering it. Pleasure is the last. You see, so when there is low blood sugar, the liver is thinking of how more blood cells will be produced by the bone marrow. The spleen is thinking about, they are all looking at how to produce. They are not bothered about how to, for you to enjoy sex. So your blood level, what is your blood level? Ensure that your blood level is within normal range. And then adrenal fatigue on your kidneys and your adrenal gland. The adrenal gland, one of their responsibilities is to help manage stress. When the stress level is too much. Now, what is stress? Stress is anything that causes the body to be imbalanced. And it could be any kind of stress. I've mentioned mental stress. Even the economic situation right now in Nigeria can be some form of stress. But you have to find a way to create a balance for yourself. You see, it could be from your job, it could be from anything. And it is important that in your space where you operate in, you must make sure that in that your space, you do not allow any stressor to remain. You have to deal with it. Otherwise, your adrenal gland will continue to, you see, continue after it will lose elasticity. You see, and this can affect your kidney functions. This can affect, and then when this affects your kidney functions, it affects your general body, the ability of the body to regulate fluid and regulate blood pressure, even part of your kidney function is for sleep. For you to be able to sleep well, your kidneys must function well. And that's why I told the men, I said they have to do every 3 hours rehydration. You have to rehydrate yourself. So as a woman, you notice that, men, you're in sexual desire, you don't enjoy sex, you don't want sex, you don't like sex. Maybe you need to increase your water intake, and then you need to manage your stress. You need to identify what are the things that are stressful to me, what are the things that cause you stress, what are the things that you need a personal analysis. Do a personal analysis, and the things you do not say yes when you need to say no. When it is a no, don't say yes. Be able to say no, I don't want this. Be able to say yes, this is what I want. Know what you want for yourself, because you only have one life, and you have to live it well. You know, you have to live it well. You have to ensure that you are living it to the fullest of the potential that God has given to you. You know, so you have to live it well. So I'm encouraging you this evening. I don't want you to begin to feel like, oh, your own has not gone, your own is not done for. But you need to ensure that you are managing your stress very well. Another thing that can make you not to be able to have interest in sex is digestive problem. Oh God, I'm sure you didn't know that your digestive health can affect whether you will have interest in sex or not. You see, conditions like bloating, digestive problem, poor metabolism, poor digestion, constipation, irregular bowel movement. All these things will not make you to have sexual interest. You will not have sexual interest. You will not be like, they will touch you from head to toe. You will not be aroused. You see, so it is important that you are having I'm telling you the things that you need to know, that you need to do, you see, that can help you to have interest, to increase your libido. Your personal life, your digestive health is very, very important. When you are having, you need to deal with that heartburn. You need to deal with that ulcer that is doing you. You need to deal with when last did you deworm yourself? Are you aware that these things have implication? Yes, they do. See, when last did you deworm yourself? That is for you to know. See, you need to find out for yourself. When last did you deworm? You understand? Dehydration can be a major factor, a major cause, a very major cause of you having low sexual libido. Dehydration can cause it. You see, sedentary lifestyle. What is sedentary lifestyle? You are doing a work that you are doing the same thing over and over. You don't have an opportunity to go. You're not having an opportunity to take an act. No activity. You're just doing just wake up, sit down, wake up, sit down, wake up, sit down. Sedentary lifestyle. There was a time I wore all those wristwatches. I don't even know where it is anymore. All those wristwatches that count step. I had it, and then one day I wore it, and I looked at the end of the day. My total step that I had taken the whole day from morning till night was 22 steps. 22. Hey. A few days later, I was standing on the ordinary ground, just on the ordinary ground. They didn't push me. I didn't fall. Nothing happened. And I just stood and I just missed my step, and my big toe, dislocated. And I knew that sedentary lifestyle was already causing disuse syndrome for my bones. I was already becoming osteoporotic. What did I decide to do? I decided to get physical. I started doing exercise because I know that my job requires that I sit down to listen to consultation, either online or physical. Sit down to go through case analysis. Sit down to go through laboratory results. Sit down to do research. Sit down to do research. So all these things require that I sit down. So what did I do? I planned a routine that every day in the morning between 6:30 or 7 o'clock to 8:39, on the days I'm available in my base in Abeokuta, Ogun State, then I go to the gym. And I did that, and I'm still doing it. I only did it when I saw that I've lost too much weight too. Because I've now lost too much weight. I didn't go because I wanted to lose weight. I wanted to be physically fit, and I was doing it. And then I found out that I don't lose weight too much, so I had to slow down. So I now go like once a week now, because all my clothes now, they are very big for me. But in case you want to lose weight, go and get physical. You understand? Get physical exercises. Do physical exercises. These exercises are good. Don't be sedentary. Sedentary lifestyle will not help you, to not even bring out the best for you, and in you. So you need to get off from inactivity. Inactivity, you sit down for how many hours to watch movies, you are watching movie. These things have consequences. Inactivity will affect you. So what are the things that you can do? What are the things you should do? I've told you need to drink water. So for a woman, also do 3 hours. Like I told the men, every 3 hours. Every 3 hours. Every 3 hours. Every 3 hours drink water from your waking up at 6. If you wake up at 7, every 3 hours drink water. You see, if you wake up, but 6 o'clock is a good time. Don't add lemon, don't add anything to it. Just drink ordinary water. Don't even warm it, just drink it. If you feel like it's, why I tell people to make it warm in the morning is that, because in the morning you're just waking up, maybe your stomach has not woken up very well. You can make it a bit warm. And I did not ask you to go and drink gallon water. Just drink ordinary, not more than 150 ml. 200 ml is fine. Don't just drink 1 liter. Blah, blah, blah. Some people tell me I wake up in the morning and I drink one. Please, there is what is called over drinking water problem. It can cause your kidneys to collapse. Please know that. So don't go. In fact, I was this month of August. I received a news headline from a woman in the US. I mean, where in the UK, I don't know where she's. She went with her family to, and she was just drinking water. Of course, she had a health condition that was making her to be excessively thirsty, and so she was drinking and drinking and drinking and drinking and drinking and drinking, and then she went into coma and never woke up. So it's not advisable that you wake up in the morning and you just drink 1 liter straight. You are playing a risky. There's a health education class that I have with teenagers. It's called risky behaviors. And so when you drink too much of water over a short period of time, a lot of water over a short period of time, you are doing, it is called risky behavior. That kind of a risky behavior can cause problems that are not necessary for you, and so please ensure that your water is regulated over a period of 3 hours. You can just split it. You can get a water. I have a water bottle. This is my water bottle, and so I split it over a period of how many hours I drink. It is even graded here. Look at it here. It has 8:30, 9. This is for 30 minutes or 3 hours. So you can get something like this, and if you don't need to get it, you can set an alarm on yourself, and then you can just ensure that you have water, and ensure that the water you are drinking is ordinary water. Don't go and be drinking mineral water. Drink water. You see, I see people who are over mineralizing their body. That in itself can cause problem for you. So please ensure that you are not drinking mineral water. I'm going to do a topic in the course of when I get to fertility issues, when I'm going to be talking to you about fertility and the simple things that people do that affect their fertility. You will be amazed how water is one key part, the kind of water you are drinking. I did a study some months ago, like last year to be precise, on water samples in Lagos, Nigeria. I took 10 common water samples. I was stunned. You see, but then if you look at the bottle of the water, you find some mineral bottle, they will write chlorine, this chloride, sodium, this, they list all the things inside. Your normal blood works already shows you that you have normal level. Why are you drinking water that has all those things? Those things in itself, and water is something that you drink that your body does not need to digest. Your body does not need to digest because it's water. It just goes in, breaks into hydrogen and oxygen, and then those extra minerals that have been fortified into the water, they now go and now bind themselves. They now begin to cause some more problems that you should not have. See how people used to get problems. So please check your water. See, check your water and ensure that the water you are drinking does not have anything. Let it just be, or just get a simple filter and attach to your tank. It purifies your water, and then you drink. These are some of the things that you can do to make your life better. So what are the things as a man and as a woman to improve? So you want to have increase. So if you found that, okay, identify the cause from all the things I've listed that affects you, and then you deal with it. But then something else that you need to do, that you can do to improve your sexual health, sexual life, is eating plenty of watermelon. Watermelon is very good. And I said it's not as if you just go and eat one piece of watermelon and say you have tried. No, 250 grams of watermelon is what you require for you to have any significant in 200, and you have to eat it every day. So it's not as if you eat it once in a week. So you can eat it in the morning, you can eat it in the afternoon, you can eat it any time of day. Eat a lot of watermelon. It's very good. And then take a lot of oats. Oats are very good. Oats have always been good. They've been with us. They have a lot of nutrients. They have a lot of the chemical makeup in them that helps your body. And like I told you people, that as much as possible when I'm doing my health talk, I avoid calling plenty grammar, because people across different age and educational level log into the program, and so I want everybody to be carried along. So don't be surprised when I'm not calling grammar. Does not mean that I don't know what to call, but I just want you to understand what I'm saying. And that's the purpose of this health education, for me to provide you with information as simple as possible. So get plenty of watermelon. Watermelon is good. It's 90% water. Again, eat it. It's good for you. Take oatmeal. Take it off oatmeal. And if you want to make oats now for you to improve your sexual life, now this is not something. Don't go and drink it and come and tell me next week time come that I drank the cocoa oats, I did not see improvement. You need to take it for a period of time, because it is natural food. It has to build up in the level in your body. But if you do it, you find that you will even feel good. Your body will feel good doing it. But if there are issues and concerns, why don't you log in and ensure that you book a session with me. But then, for the sake of this time that I'm going to be dealing with the men and the women matter, I'm going to have a combo, the men matter pack and the women matter pack. The men matter pack is going to handle, in it has antibiotics, have men matter, has things to, different things put together in a combo for the men and different things put together for the women. Before now, it used to just be the women matter tea or the men matter tea that people get, and then, but over time, as I interface with people, as I interact with people, I find that sometimes their needs are more. So in this men matter pack now, there's something for fertility, there's something to boost sperm, there's something to improve erectile function, there's something to prevent infection. That is a combo for the man. For the women matter pack, there's something to improve fertility, there's something to prevent infection, there's something to improve ovulation. That is a pack. So if you're interested, please reach out to the numbers that are showing on the screen for both the man and the woman. Now, so for the oatmeal, you are not swallowing it, you are drinking it. You put it inside water, make it like that and drink. It is not a swallow. You are not cooking it, you are not swallowing it, you are not making it at anything. You just drink it like that. Put a tablespoon inside a cup, leave it for like 2 or 3 hours. 2 hours is fine. And then you drink it. You can drink it in the morning, you can drink it in the night, but you can drink it twice a day. But now these things are just things that are like food for you, that provide you with nutrients to help your body to be well. And that brings me to the end of my presentation today. I do not want to exceed 1 hour 30 minutes, and I'm already 1 hour 28 minutes. I didn't know that this topic, addressing this topic, would take this much time. So I'm just going to go through the charts now and see the questions that are there, and I'm going to answer the questions. And if it's a question I've already answered, I will just let you know that I've answered it. So thank you, you're learning a lot. Okay, fine, thank you very much. You say, what of swallow, ma? I already answered that. You're not swallowing it, you are drinking the oat. Like, you just put it inside water and drink. Okay, so if there's any other question, let me see. If there's any question, what is the normal range of weight? Okay, so I cannot answer, there's no general normal range of weight, because your bone mass, you see, so your own body and my own body is not the same. So I cannot say that the normal range is someone weighing 80, someone weighing 90, someone can be weighing 90 and their BMI is within normal. Someone can be weighing 62 and their BMI is abnormal. So it's for us to, so there is no, of course there are weights that are above, so you cannot be weighing like 200. That one is not, so, but I'm trying to say to you that when it comes to weight and when it comes to assessment of what is ideal for someone, it is individualized. See, that's what I'm trying to say. If you saw me some months ago, like in April, I was size 18 small, big size 16. Now I'm size 12. If you saw me then, you would not say that I'm obese. You would just say, you have met people that say, I have added weight. Because I'm tall, I have heavy bones. You see? But I decided to lose weight because I saw that any small misstep, I was having dislocation, I was having issues with my bones. And from my personal knowledge, I used that to decide that, no, this is not right. And so by the time I calculated my own BMI, I saw that I had already crossed, you see. So I decided to do something. So now I'm at size 12. Now I'm size 12. I came down to size 12. I was not just gymming, and when I come back from gym, I sit down and eat. The same. So I have a health group. And I gave some people 1 week therapy. That 1 week therapy is to improve the enzymatic function of their body. Some people did it, some people didn't do it. But I have decided that if I'm going to give a therapy to people and they are not going to do it, I'm not going to waste my therapy anymore. After all, people pay me a lot of money for me to give it. And so if I now give it free of charge and people are not using it, then it's fine. Let me leave it. When they need it, they will pay money for it. You see? But one of the things that therapy was to help them do was to improve their digestive system, because one of the reasons you add weight, especially weight that you don't need, is because your metabolism is slow. if your metabolism can be improved, if your metabolism is improved, like you eat, your digestion is as it's supposed to be, and you are moving bowel as you ought to move bowel, you will not find yourself at the other side and then you are active. You understand? So I believe I've answered your question on weight. There's no, yes, you are not putting it on fire. Yes, you are just putting it inside and drinking. Yes, you are not cooking it. And you do that, you can do that for like 2 weeks and you stop. You know, just put it and teaspoon in a cup of water, you just drink it. You soak it for like 2 hours, you drink it. And don't forget to get our Men Matter pack and our Women Matter pack. It is put together to address all the men matter issues and all the women matter issues. Women matter is plenty, men matter is plenty. We just scratched a surface of it today. In the men matter, you have erectile dysfunction, you have low sperm count, you have male infertility, you have, this penile shrinkage, so you have prostate. In men matter, prostate is there. Another prostate, you have prostatitis, you have benign prostate hyperplasia, you have different conditions. In the women matter, you have ovarian cysts, you have irregular menses, you have absence of ovulation, you have abnormal menses, you have fibroids, there are different things. So the women matter combo addresses this, the men matter combo addresses it. Please understand that this is different from men matter tea. Men matter tea is tea. Men matter is tea. Men matter combo is a pack that contains something for erection, something for to prevent prostate problem, something to improve sperm count, something for men reproductive health like fertility. You see, it's a combo. It's a combo that has different things inside of it to help the man to be at his best, irrespective of his age. That is one. Women Matter pack is not Women Matter tea. It is a pack that has different things that addresses different issues inside the pack. That is a woman listing. That is it. The Women Matter tea is just one of the items that is inside that pack. You see? So don't say I said Women Matter tea. Women Matter tea is tea box. Women Matter pack is a combo that addresses those different women issues. You see, Men Matter tea is one tea box that has one tea box that you drink that help your men, like your men health to be alright. The Men Matter pack is a pack that has different things inside of it to deal with the different complaints. Yeah. Alright. Oh, okay. You see, somebody is saying it. Okay, so Jesse Precious, you say you are correct, my dog. The therapy really helped me. You see, this is someone who did the therapy. Yeah, thank you for saying that. Wow, that's beautiful. Okay, I don't have oats. I don't sell oats. Go to a supermarket and buy coca oats. I don't sell coca oats. You see, the things that people can buy, I don't sell it. Doc, are you saying we should put the oats in code? Yes. Also, is the opportunity of running tests available in your office? Okay, so for me to tell you what test to do, is best you do a consultation with me. And then when you do a consultation, I did a health assessment for someone today. And I think the person is online and wouldn't mind me mentioning this. In the course of the assessment, I was able to tell the person, don't eat this, don't do this, don't do that. The person did an assessment. But a consultation is you just tell me, I'm having a headache, I'm having back pain, I'm having this, I'm having that, I'm having that. I can just give you general knowledge. But a health assessment, everything I'm telling you is based on what your body requires for it to be well, for it to prevent the problem from coming again. So while we can guide you to know what test to do, I don't run any test. You see, I don't run any laboratory test. But I can give you tests to do. But I can only do that when I've had time to consult with you or to do a health assessment for you. The reason why we do consultation without health assessment is that somebody may not be able to afford health assessment. The person may just be able to afford a consultation. So we do a consultation with them and then they do it. But a health assessment is that we are analyzing. We analyze you. When I'm done analyzing you, yourself, you will know that you are analyzed. The people that I have analyzed, they can tell you. No, we spend. I'm asking you questions. By the time I'm finished asking you all the questions, all your life, plus the things that, you know, okay, for the laughs. So I went to do a consultation this week, and I was telling the person, I said, I don't do consultation per couple. I do husband, I do wife. So the man was like, why? I said, because I have done this kind of thing for a couple that wanted to get married. And I told the woman, I said, madam, you don't know the depth of the questions that are in my consultation. I suggest that this your fiancé, the fiancé that brought him, this your fiancé who brought her, will be outside. She said, no, it's my boo. There's nothing we can. I said, madam, kindly allow him. The man was even saying, let him go. She said, no, boo, we are together. I said, okay. We started asking questions. By the time the question began to excavate, she began to stammer. I said, madam, you have to answer. There were things that, because it's an assessment, you see, I'm trying to find out, why are you having this problem? I'm trying to find out where is this disturbance coming from? Where is the root of this disturbance? And then what do we need to stop this disturbance? You see, these are the things that the assessment is helping me to find out from you. What is this assessment? How do I get this assessment? How do I get you to be well? How do I get you see? So that's how she began to talk. She began to talk and say, so I've done this. Hey, the man was looking at her. No, I cannot marry someone that I'm telling you, they did not marry. That's the end of the marriage. That's the end of the marriage. And I had told her, I said, madam, that is to tell you the depth of the cause. Usually when people say, they say, no, I don't have any complaint. By the time we are done, the book is full, the paper is full of different complaints, because the things people have cultured themselves to manage abnormality. There is this pain that has been biting you in your breast, that it comes and goes. Because it comes and goes, you did not count it as anything. Meanwhile, that is your lymph node telling you that some cysts are abnormally forming. In the course of assessment, as you begin to look at your lymphatic system and the lymphatic activities, the questionnaires are developed to help bring those things out. You begin to find out, oh, thank you very much. That's very true about the analysis testimony of our consult. Thank you so much for that feedback. Thank you so much for that feedback. Thank you so much. I appreciate that. You see, the analysis will excavate things out. It will bring up things. 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 By the time we bring them out, we're not bringing them out. We're bringing them out and they were telling you, do this thing, do this thing, do this thing, do this. And if you do it, even when I don't give you medication, you will see changes. I'm telling you the truth. And I have a group. Many of the people there are people who came for live sessions and they just joined the group. So I gave them challenge. I said, do this. If you do it, you will see the change. If you didn't do it, you will still see how your body will be. You see, this next week now, from this week up until the next live session, I want to go into immune enzymes. If you have watched that live session when I was talking to you about enzymes, if you've not watched it, go to the last videos and go and watch them. So I want to give them enzymes. Now these enzymes, if these people can do this therapy, what that therapy is supposed to help them to do is to help their immunoglobulins and their T cells, which are immune body cells, to be very sensitive so that abnormal tumors will not grow. Because I talked about the origin of why does cancer form in your body. Cancer can form in your body because the watchmen are not observant. That's why they are not observant. So a cell is misbehaving. They are looking at him. The cell will misbehave. The cell will go to another place and join. That means that it's now spread to another location. It will now attach itself to the lymph node. Lymph gland will now carry it around the body. You now say that cancer has spread. Where were the immune systems when these things were forming? They lost sensitivity. What are the things that make them to lose sensitivity? Please go to that video and go and watch it. I talked to you about the different barriers that the body has. These different barriers, they serve to protect you. Your prostate gland has a barrier. If that barrier is broken, you will have abnormal prostate cell formation. Your pancreatic cells, your spleen, your liver, God put all these defenses so that before one thing can overshadow the body, it will break through. But when there is lack of sensitivity, and I told you the things that causes the insensitivity. You see? You understand? So it is very, very important. It is very, 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 very important. Very, very, very important, my darling people. Very important. You see, that you take advantage of that immune system therapy. It's a tough one, no? In fact, I was saying that if anybody wanted to lose weight, when you are done with that immune therapy, you will lose at least 5 kg. I'm telling you the truth. You will shed. I'm just see me now. I've shed weight. If you saw me 3 months ago, if I want to add weight now, by the next time I will add weight. If I want to lose it, I can lose it. All of them is knowledge and application of the knowledge. I'm telling you. You see, so it's just something that you need to take note of. You see, so all right. So let me answer questions. Let me look at questions. Yeah. Okay. What of a woman that is circumcised? Okay. You see, the top of the clitoris has been cut off, which is the side of it that has a circumcision is that cut off of that part, the clitoris, so that the woman, that is where like the nerve ending, you know. But it does not mean that you still cannot enjoy sex. So first of all, even if you have been circumcised, you need to understand in your mind. Remember I told you that there is the mind and then there is the metabolic activity. So in the mind aspect, you need to now know that even though that place has been cut off, you can still enjoy sex. You can still desire sex. You need to understand that. You see? You need to understand that. You now need to find out as a person, what are the parts of your body that are most easily excited. For some people, they'll enjoy for them to have foreplay, like for them to be kissed, for them to be touched. You need to know. You need to know your body. Where is, do you know your soft spot? Your spot, they did not cut off all your soft spots. So that places, those places that you are sensitive to when you are touched, those are places that you communicate with your partner that can help you to get an arousal. I hope I'm answering your question, you know. Okay, so how much is the consultation with you online? Okay, so consultation with me online, if it is health assessment plus consultation joined together online, or you come to my office, is 150,000. If it is only consultation, that is, we are doing, no, we are not doing health assessment, or it is only consultation we are doing. And even the consultation itself, you will still tell me, doctor, thank you, I can assure you of that. That one is 50,000. If I am coming to meet you where you are, that one is much more. There are other factors that determine that. So that is that. Now for the combo for men. The combo for men, ordinarily, the combo for men should have been 120,000 naira. For the, whether for men or for women, it should have been 120,000 because of the combo, because of the things that are inside. But as usual, I have decided that I want to do a discount for the combo for men. So for that combo for men, Now please note that this is exclusive of courier charge. There's no courier charge in it. So for the combo for man that has those things that I talked about, I'm now giving you for a discount of 100,000. So I remove whether for man, whether for woman. Now this is not the one box of tea. No, this is a combo that has all these things put together. You see, that addresses these different. There's something inside for boosting sperm count. There's something inside to prevent or treat infection. There's something inside for prostate. There's, you see, all these things. That is what I have talked about now. So the combo for men now is on discount 100,000 minus courier charge. That is the combo for men or the combo for women. That is it. So you get it, you use it, you come and tell me. You hear me? I'm live every 2 weeks. You come and tell me how far. You see, you come and tell me how far. You will see it. If you have low sperm count, before you go and do it, before you start using it, go and do test. When you start, finish it. When you finish it, go and do test. Like me lab, no dey lie. Go and do it. See, you do it. You are having, you know, whatever it is, do it. You understand? It's, you know. So these are the things that it is. So is there any other question? Is there any other question? I think we have. Thank you so much, everyone. If there's no other question, the next episode we are going to be talking in the next episode. Remember I told you that we are dealing with different men issues, and we have talked quite a lot. If you came in late, please try and watch the video from the beginning. I talked about erectile dysfunction, and I really talked about a lot of things. I talked about penile atrophy, that is when the penis is shrinking or the penis is becoming, losing mass, losing muscle. Penile atrophy is called penile atrophy or penile shrinkage. You find that it's shrink. I talked about the different things that can cause it, and then I talked about today about low libido in women, and I talked about different things, and I said both man and woman, something that you can eat as a food. This is not as a treatment or a cure of any problem that you're having, please, you know, but something that you can eat, something that you can take that can improve your health, your sexual health. You know you can. I told you, I said 250 milligram of watermelon, you should get it. Get oatmeal, you should get it. Exercise, do aerobic exercise. Dancing is an aerobic exercise. You want to improve your sexual life, dance. Spend some time to dance. Do a lot of dancing. You see, they help you. And then I talked about exercise for your pelvic muscle. I talked about Kegel exercise. Kegel's exercise is that kind of exercise that you hold your bum and everything as if you want to wee wee. You know that one that if you are pressed, you hold it for 30 seconds and you release. Count to 30, hold it, count to 30, release. Do like that like 15 times in the morning or throughout the day. You know, just it's an exercise that you can do by yourself. See, all these exercises, when you did, what happened? You are increasing blood flow and you are helping the muscles there. You are helping the muscles. And I told you, I said, as a rule of thumb, please ensure that you have sex. If you don't want to have disuse syndrome, disuse syndrome means that you lose sexual function because you are not sexually active. Please, as much as possible, if you were not sexually active before, you see, your body can stay, you can stay, you're not sexually active. But when you are married and then you now say we are doing okay, you are doing abstinence, and you are abstaining for so long. So what is the role of hormone? Because the person that asked this question is my father, I'm going to answer it because I've already answered it before. But it's my dad that is asking this question now. So the role of hormone in sexual dysfunction, erectile dysfunction. Now, this hormone for a man now or a woman, the testosterone is a sex hormone that is responsible, and this is usually, this production is regulated, you know, it's regulated by the body, and when the levels are within normal range, they trigger responses through the different signals in the body, from the brain to signal to the heart to signal blood to flow down, you see. But even if someone's hormone is functional and his hormonal level is okay, and the person has obesity, or the person has arteriosclerosis, a condition known as where there is deposit of cholesterol fat in the arteries, or the person is obese and there is deposit of fat in the arteries that are supplying the penis, the amount of blood that gets to that part is reduced. And for there to be an erection, there has to be enough blood flow. So when there is a reduced blood flow to the area, even though the hormone is functioning well, but there is an obstruction in the arteries as a result of reduced blood flow, what happens is that the person can find out that they are not getting erection. They are not able to maintain an erection. You see, so these are the things. I hope I've been able to answer your question, sir, on the role of hormones. So hormones trigger, hormones send signal, hormones can make you get aroused. When a man sees a woman and the woman needs an image that the man fancies, that part of the body that can trigger a desire, those function, that role, that process, those are the activities of the hormones. You see, but the body can trigger reaction and the penis did not stand up because there is blockage. See, so I hope that I've been able to answer your question, sir. So I thank you so much for logging in to the meeting today. Today we talked about erectile dysfunction, and I hope that erectile dysfunction, penile shrinkage or atrophy, and loss of libido in women, and the things that you can do. And I said that we have the combo for the man and for the woman, and I said you can book your consultation with me. For every of all these things, you get value for your money, I can assure you for that. You know, so in the next 2 weeks, we're going to be live again by God's grace. And you can feel free to use the link that is there to join the health and wellness group and participate in the immune therapy that is coming up. Remember that one of the ways that you can improve your health is to eat right, to live right, and stay right with God. God will help you. So do your part and God will help you by doing his part. So if there's no other question again, I would beg to take a bow from the meeting today. So I hope I've answered all of your questions. I hope that I've answered your question. Thank you for watching from Ibadan. Thank you from Port Harcourt. Thank you so much. Thank you so much. Thank you so much for watching. I will see you as we continue the Men and Women Matter series. I want to encourage you to subscribe to the Ask Dr. Rita show page on YouTube here. Subscribe. You've gotten something valuable. In the next 2 weeks, we're going to be live. Talk to people. Tell your friends. There are people who need to hear these things. You know, there are people who need to hear these things. And thank you so much. I told you, I said, on my 40th birthday, I heard the Holy Spirit say to me, say, go and teach people how to live well. And that's what inspired me to come. And the things I give to you, they are things that are valuable. I don't give you things that are not valuable. I take time to do studies. I take time to find out what it is that you can do. I read, I research, I pay for researches, I pay for a lot of information that I get, you know. So yes, the man combo is on discount now. So you can get the combo. You can get the man combo for 100,000. You can get the woman combo for 100,000. You know, instead of 240,000. And I'm telling you, the combo contains something for improving your sexual health, improving your treating infection and preventing infection, something to help your prostate gland, something to boost your sperm count, you see, something to boost your sperm, something to prevent cancer. That was something that I didn't remember to mention. Yes, you know, so these are the things that are inside. And if you wanted to do each of these one, it would have cost you a lot more, but I just said that since it's a series, let me just do this combo for you. So something to prevent cancer, something for prostate, something for infection, something to boost your erection, something to boost your sperm count. These are the things that you can get. And then for the women, something to prevent cancer, something to improve fertility, something to improve ovulation, something for your menses, something to prevent infection. You know, so these are the things that you can do, you know, and those things, you know, when you use them, you will be very grateful. So I'll see you in 2 weeks' time. I'm sure you have had a good evening. Have a good evening. Bye. See you in 2 weeks' time. Bye, 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 bye. God bless you too. Have a good evening. Thank you. So we're still like.
My screen.
So we're still like.
Yes.